challenging. Anyway, I'm here to talk about two mobile services that we have launched in the past year in the state of Bihar, which happens to be very much in the news for all the wrong reasons today and yesterday. But I work for the BBC Media Action, which is BBC's development communication arm, and we've been working on the Shaping Demand and Practices project in Bihar since January 2011. This is a part of the Ananya program, which is a result of a memorandum of cooperation between the Bill and Melinda Gates Foundation and the government of Bihar. What we do is, even though I'm here to present two mobile innovations, but we really look at a 360-degree approach, but more on that in probably offline conversations if anybody is interested. I'm conscious of the time. What our challenge, or what we had to do, was to basically improve the ability of a frontline health worker, the ASHAs and Anganwadi workers in 8 districts, which are currently our arena, but we are scaling up to the rest of the state by 2015. We had to improve their communication skills and refresh their knowledge base. There are a few things that I want to highlight because there's very little time. So we were conscious that we had to always aim for scale and sustainability, and therefore one of the things we had to look at was appropriate technology. We knew that the frontline health workers in these 8 districts and later on in the rest of the state had very basic mobile phones, and we found out through our landscaping study that most of them, more than 98% of them, had access to a mobile phone. So what did we do? The first service was Mobile Academy, which is essentially an IVR-based service. So as we often say, is we went back to one of the oldest technologies, that is IVR. So we literally rang out the new and brought in the old, because we did not want to get into something that required a lot of expensive hardware to be distributed, once again going back to scale and sustainability. So essentially, this is an IVR-based service through which we had to cover a lot of content, because what we are working on is essentially maternal and child health, and therefore a 1,000-day period from when a woman gets pregnant to when the child is 2 years old. So we divided the entire curriculum. We took a continuum of care approach, which means you start right at the beginning and then go up to when the baby is 2 years old. So we divided it up into 9 chapters. Each chapter had 4 lessons. We created the character. Yeah, we created a character called Dr. Anita. The other thing that we had to do was to create a toolkit, and if we had to create content that would cover these 33 months, we would have to possibly give a frontline health worker a suitcase. And we knew we couldn't do that, and we didn't want to do flip charts which get invariably left behind. So we came up with this innovative audiovisual job aid called Mobile Kunji, which is essentially a combination of this deck of cards that you see on a ring, and each card has a unique short code through which you make a call. The frontline health worker, when she visits a household, she shows this card. I can show it to you later. She uses this card to communicate a particular thing that she wants to talk about, and then she calls the short code on the card and makes the woman or her mother-in-law listen to Dr. Anita. So these two services were rolled out in May of last year. Just to go back to some numbers, we've had up until now nearly 30,000 unique users for Mobile Academy. That's the number of minutes that they have accessed, and the frontline health workers who have completed their course with a certain pass mark are getting certificates from the government of Bihar. So that is a huge deal, because other than refreshing their knowledge and giving them a workable job aid that they can carry around, it is also about empowering them and making them really feel that they are professionals and people are investing in them. Looking at Mobile Kunji usage, we've had over 100,000 unique users. Total number of minutes used over 3 million. Lots of interesting anecdotes coming in while we are actually there is a back end, so everything can be tracked. we are also sort of looking at the impact that this has had. But we've had interesting stories, lots of anecdotes coming in of actually these two services making a difference in the lives of not just the frontline health workers, but having impact in the lives of the women that they're supposed to counsel. So that's what I have to say. I'm conscious that I'm done. So any questions?
Thank you, Radha. Let's have one question. We're running really short of time, so let's just take one quick question.
Good evening. It's a wonderful initiative. I'm just trying to kind of figure out that you've written in early part that you have partnerships with all these mobile providers, but the cost seems you're saying is being paid by users. So how are they partners?
No. So what we have done is we actually had to arrive at a workable business model because we are looking at sustainability. So Mobile Academy is a service that's paid for by the frontline health worker, and we have tied up with 6 mobile service providers, the whole range actually, and we have we have negotiated a deal through which the frontline health worker has to pay only 50 paisa per minute, which is right, Priyanka? So that's about a 90% reduction in the call cost. Mobile Kunji, however, is at the moment being paid for by the project, but the government is going to start paying for Mobile Kunji calls in about 3 to 4 months' time.
But how is it a 90% call cost? Isn't a normal local call about 40-50 paisa?
No, the duration of a Mobile Academy lesson is 2 minutes. It's a vast service. It's a value-added service for which, yes.
Okay, good. Thanks very much, Radharani. Sorry to cut you short. We're running pretty short of time, so we have 3 more presentations to listen.